Welcome to April's Webinar Wednesday. I am going to give a high-level overview of Respite Care Association of Wisconsin's programs, grants, and free training opportunities that we have available. And then I'm going to turn it over to our guest speakers today, Lauren and Erin. So I'm going to go ahead and get started and share my screen. Let's see. And just some housekeeping, if you wouldn't mind keeping yourself on mute, unless you want to ask a question, you can absolutely stop me as I'm talking to ask a question, or you can pop them in the chat that will be monitored. And same goes for Lauren and Erin. All right, so RCAW, we are a statewide nonprofit. We serve all 72 counties in the states and 11 tribes, and our mission is to promote, support, and expand quality statewide respite care across the lifespan. A little bit about what is respite. It can be planned, or sometimes it happens on an emergency basis, but essentially what it is, it's an opportunity to give the primary caregiver some time to rest, refresh, recharge, take care of their own needs. And like I said, sometimes it happens on an emergency basis if there's an unforeseen circumstance in the family and that caregiver needs emergency care to the care recipient. There are a lot of benefits in receiving respite care, I should say. One of the things that most people like to think about is how it is a benefit to the caregiver. Now, that is absolutely true. However, we never want to forget how much of a benefit it is to the care recipient. Oftentimes, if a caregiver is burnt out and exhausted from their role of being a primary caregiver, they're not able to provide care at their best level, or as their best self, some people like to say. So getting that opportunity to get away and take a break, it's a benefit to both parties. It definitely it increases social awareness and social engagement. It can decrease isolation. Oftentimes a caregiver, regardless of the age of the care recipient, if it's a child, adult, or older adult, or regardless of the dynamics of the diagnosis or age, a lot of times caregivers report that they feel isolated. Sometimes their friends don't come around as much, and getting that break gives them an opportunity to go out and take care of themselves, and whatever that looks like for them. It can help promote relaxation. It makes them feel that there is assistance and support around them. It can boost mental health. It absolutely boosts mental health and physical health. And it also allows the primary caregiver to maintain that sense of identity. We did a poll of recent family caregivers that we served with our Caregiver Respite Grant program. And the number one feeling that they had, or the number one challenge that they had in their lives, they felt completely overwhelmed. Secondary, the financial burdens of taking care of a loved one. And you can see lack of socialization and strain on relationships also came in, depression and anxiety, physical or other physical health ailments, as well as lack of sleep. We like to know what caregivers do with their time when they get respite care. Most spend time with their other family and other friends or family members. Also, reconnecting with a spouse or a partner, participating in social activities, time to relax. Some people like to use their respite time to complete household tasks and do things around the house that they're normally not able to do because of the demands of being a caregiver. There are a lot of barriers. Oftentimes, and sometimes this can be cultural, and of course we respect that, but sometimes caregivers can be too proud to accept help, or they think, I'm a wife, this is my job, or I'm a parent, this is my job. Also, there are a lack of trained respite care providers available to family caregivers. We saw a few slides back, one of the biggest burdens is finances. So the affordability of hiring someone, and also not potentially not trusting others to do the job. And I'm going to show you how RCAW, we help break down those barriers. First, we always like to reframe how respite is brought into people's lives. It's just as much of a benefit to the caregiver. And we also want to encourage primary caregivers. This can potentially help during emergency situations, but to be proactive rather than reactive. We have seen an incredible increase in caregivers reaching out to us for our caregiver grants that I'll touch base on in a few minutes, because they're having a mental health crisis. So being able to take that break hopefully can lessen the chances of someone having a mental health crisis. All right, I want to touch on our free training opportunities. We're going to talk about all of these, but first, we're going to talk about the respite care provider training. Essentially, the respite care provider training, it's free, it's online. Learners can earn a certificate of completion for 7 hours. And this is really geared towards people who want to give back to the community. They want to be able to give the break to the primary caregiver while also doing creative, meaningful, engaging activities with the care recipient. This training touches on varying disabilities across the lifespan. Of course, we could spend hours and days going into specific diagnoses like autism or dementia, depending on the age of the care recipient, but it's a general overview of varying disabilities. Like I said, there's no cost. It is state approved, so those who potentially want to provide respite care and get paid through Medicaid dollars, this training does meet the requirement. And once someone successfully completes the respite care provider training, they are offered, they don't automatically go on the respite care registry, but they're then eligible to list themselves as a provider. And we'll get into the registry more in a bit. These are the courses to the respite care provider training. It goes into what is respite, disability basics for respite care providers, client care, medication administration. Now, it definitely, some people think that they can get their medication, their med pass certificate. This does not go that into depth, but it's medication awareness, abuse and neglect, caring for those challenging moments, wellness and household. Wellness and household and free time activities, professional ethics, meeting with the caregiver, and also the registry. Our training and development specialist on staff, Val Madison, created a kit for respite care providers. So anyone on the call who's either interested in potentially providing respite care or passing on the information about this course to others, we do have a kit for respite care providers. The why behind these two courses being created is we would have people go through our free online training and be listed on the registry and say they weren't getting a lot of calls. Now, we know that absolutely there is a need for them. So we went ahead and created a course on how to market yourself as a respite care provider, and also the other one's becoming an independent respite provider. And that goes into different payer sources in Wisconsin. You don't have to go through the course in order to download the PDFs in the course. You can go to our website, which I'll share with you in the chat if you're unfamiliar, as soon as I'm done, and you can go ahead and take a look at those. But yeah, they've been very helpful in helping providers market themselves. We also have a kit for caregivers. Oftentimes, if they have been thrusted into the role of being a caregiver and they know that they need respite, it can be completely overwhelming knowing how to hire someone, how to train them, and most importantly, if it's a good fit, how to retain them in their life. So this is also something where you don't have to go through the course. You can go to the webpage on our website and download the pertinent materials. We do have some specialized training. We've partnered with UW-Oshkosh and Cadet. We do have, we will cover the cost for any family caregiver who wants to go through the Dementia Generalist. We are happy to cover the cost. We connect with them, and then we connect them to UW and they can go ahead, and that's a free online course. It's not like we don't check up to make sure that they've finished it, and then so they're not responsible for the cost, and they can do it at their own pace. Anyone who has gone through our respite care provider training, and if they choose to care for someone living with dementia, we are also able to cover the cost for them to go through the dementia generalist for healthcare providers, as well as the dementia specialist. And if any professionals are on Webinar Wednesday today and they're interested in this course, but they do not want to go through that training, I can certainly, for coming today and you learning about RCAW, I'm happy to go ahead and connect you with Cadet at UW Oshkosh so you can take the course. The next thing I wanted to talk about was our registry. So essentially it is a bridge to connect people who need respite care to those who provide respite care. Now something that's really important to point out is we are not the employers of the respite care providers listed on the registry. They are on there, and it's a consumer-based site. So it's up to hiring. It's up to the person hiring them to do the interview and the background check and make an informed decision for themselves. And that is also something that is in the kit for caregivers on how to hire, train, and retain a respite care provider. There's no cost for people to list themselves on the registry. There's no cost to search the registry. And the end user can filter their search by age of the care recipient, the county in which they live, and the type of respite. The two types of respite would either be in-home or community-based. And we do have agencies listed on the registry. Now, those agencies are agencies that have come to us and said, we have ability and we have the staff and the capability to take on more clients. So then they get added. There is registry compliance to assure that everyone's information is updated and appropriate. So every 3 months, anytime someone is on the registry, they then need to communicate with us. They get an automated email and they have to verify that their information is still updated and accurate. And then they remain on the registry. And if they don't communicate back with us, we do remove them. This is an example of someone listed on the registry. It shows their full name, their email, how to get a hold of them, the counties in which they work, as you can see on the screen, anything that they're able to do as far as experience and history, education, certifications. It shows if they've had a background check. And then, as I said, it's up to the primary caregiver to reach out to them and schedule an interview and hopefully get that support in their home that they need. All right, my favorite part about RCAW are our grant programs and how we're able to help primary caregivers. The first is the Caregiver Respite Grant Program. To be eligible, we ask that a primary caregiver tries something else first, meaning that they go to the ADRC and to see if they're eligible for a long-term care waiver support, or if they are a caregiver of a child, if they go to the county. So if someone can show that they've applied for a long-term care waiver and they are not expecting to receive those services, or they've been waitlisted, if they've been denied, sometimes denial potentially might be over assets, although usually people know that going in, but people do get denied potentially if the care recipient didn't meet the requirements for the functional screen. If they've applied for and they've exhausted funding from their long-term care waiver or other grants, or if they need the flexibility to hire a friend or family member, or if they've not applied yet because they're not eligible, and typically that is because of over assets. The great part about this grant is the applicant can hire anyone they want. So touching back on one of the barriers is sometimes primary caregivers might not trust a stranger quite yet, or they want to walk before they run into respite care. Applicants can hire a friend, a family member, a neighbor. You certainly can hire someone from an agency. We also have applicants use these funds if the care recipient is older and might need a skilled stay or at a community-based residential facility. So we have no preference on who provides the respite care, what type of respite. We just want that caregiver to get a break. We also have a CORE grant that stands for Community Outreach, Recruitment, and Education. This is an agency-based grant, and we have ADRCs apply, counties apply, independent agencies apply. We love to work with tribes and expand respite care within Native Americans, and as long as they want to put on a one-day event that can help increase awareness of respite care, the recruitment of respite care providers, educating family members, we can award up to $3,000 and work right alongside with them. We have a group respite grant, and it is exactly what it's called. It's for any outside agency that wants to provide respite in a group setting. Oftentimes there are support groups, book clubs, activities for caregivers, but a barrier is they can't go because they don't have someone to provide respite care for them. So I'll just give an example of organizations that have applied for this. There's one in the Fox Valley called the Fox Valley Memory Project, and they will have events for caregivers caring for a loved one with memory loss, and they'll hire CNAs to come in and provide respite on site. And the caregivers can do, I believe the last one was a book club. We also have Barron, Ruskin, Washburn County right now. They're in the middle of a group respite grant program, and they're doing powerful tools for caregivers. It's a 12-week course, and the caregivers can bring their loved ones with them. And on the same property in another room, there's an activity room, and the care recipients get to do meaningful activities with respite care providers. So it's really helpful to everyone. The next grant that I want to talk about, I'm going to skip these two slides while I talk, and I'll just show this slide with the allowable expenses. So it's the same eligibility criteria and the same application process as the Caregiver Respite Grant Program. And the difference are the allowable expenses. Now, this grant can help with home modifications, assistive technology, home delivered meals, or in-home meal prep. Most applicants use it for housekeeping, so someone to come in and help them keep their home clean and kind of take that burden off them in that way. And it's the same as the Caregiver Respite Grant, RCAW. We show no preference on who provides the services. If they want to hire a friend, a family member, a neighbor, or someone from an agency, that is just fine by us. Let's see. Here is our information. I'm going to stop screen share, and I can put this information in the chat, and then I'm going to check the chat for questions, and we will go from there. Oh, thank you, Leslie. It seems like you have been sharing. Perfect. Okay, thank you. All right, well, I want to turn it over to Lauren and Erin from the Respite Center, Rise, Wisconsin. Hi, Lauren. Hi, Erin. Thank you so much for joining us today. Would you like to introduce yourselves to everyone?
Absolutely. We'd be happy to. I just put a link in the chat, by the way. We have 2 videos we were going to share. One of them, the quality doesn't look great when sharing screens, so we put it in the chat in case you want to watch it on your own time. Also, RCAW will be sending out an email after this presentation, and the link will be there too. So it's a video of a child giving a tour of our space.
That's awesome.
Let me share my screen, and we will introduce ourselves too.
Thank you so much for coming today. I know everyone is really excited to learn about the services and everything.
Thank you for having us.
Thank you.
Thank you. So you're child care specialists at the Respite Center in Madison.
Yes, we are. Just admitting one more person. Okay, there we go. So we are childcare specialists. We really appreciate everyone coming here today. It's really wonderful to be seeing all these names I don't know, because then we get to network and meet new people and hear about what respite means to everybody. So we really appreciate you being here with us today. We're here representing the Respite Center in Madison, Wisconsin. And I'm Lauren, and this is Erin. And we're both childcare specialists in the space that's pictured on the slide. So you can kind of have an image in your brain of where we work. And the past couple of years, Erin and I have, outside of our childcare shifts, been doing a bit of development and community outreach. And we are going to share with you some context to what the Respite Center is, and also share with you the results of our parent wellbeing study, which is our first quantitative study for program evaluation. And we're very excited about those results. So thank you everyone for being here. So Erin's going to start off by just posing some topics for you to think about too.
So the Respite Center was started because we understand that parenting is one of the hardest, most challenging jobs. And while it can be very rewarding, it can also be incredibly challenging, especially when you're facing, additional life stressors. So I'd like everyone to reflect. You can either just kind of reflect on your own, or feel free to share in the chat if you have some thoughts you'd like to share. Particularly for caregivers, what are the most challenging parts of being a caregiver, and what are your primary stressors as a caregiver? And as a caregiver, have you ever needed a break? And if you have needed a break, who do you rely on for those breaks? I'd also like to point out the lovely artwork here that is something that a child did at Respite that says in glitter paint, "Mom, #1, with a few flaws." Yeah, so
Honest, nobody's perfect. No parent is perfect.
Absolutely. All right, so now that we've kind of thought about what are some of these challenges of being a parent, what would that be like if you were experiencing housing insecurity? Now, what is your biggest challenge? What are your primary stressors? And how does homelessness affect your ability to care for your kids? Thinking about bedtime routines, family dinner time, getting your kids ready for school and actually getting them to school, looking for housing, keeping your job, and getting transportation to work. Imagine you're fleeing domestic violence. What is your biggest challenge now, and what kind of stressors are you facing? How does the violence in the home affect you and your children? Who will care for your kids when you're searching for a new place to live, for a job, meeting with lawyers or court appointments? And then also, what is the impact on your child? How has this violence and instability affected their behavior in terms of safety, attachment, relationships, acting out versus withdrawing, role reversal, regressing, just overall trust? Imagine you have a chronic health condition. What is your biggest challenge, and what are some of your primary stressors now? How does this health condition affect your capacity to care for, to be a parent? Thinking about if you're on bed rest, if you have lots of appointments, who's providing childcare for you, and just the overall emotional toll and energy level you have, not only just having a chronic health condition, but having to parent on top of that. So the Respite Center was started with the understanding that parents are facing a lot of stressors. It's hard to be a parent in general, and it's even harder when you're in a variety of crisis situations. So the Respite Center was started to help support parents in these situations. We began on a house on Williamson Street in Madison, Wisconsin. And we were founded in 1979, so we've been around for 43 years. And many of our staff have been dedicated to respite for decades. They've built relationships with families in the community. They've watched kids grow up. So that's been something that's really special to have staff that's that dedicated. And we've also always been the sole provider of center-based respite and emergency childcare and crisis intervention in Wisconsin. So a few years ago, we merged with other service providers into an agency called Rise Wisconsin. And this created a closer network of wraparound services for families and individuals in the community.
So as I mentioned before, I put a link in the chat to this adorable video. This is a kindergartner who has used respite several times. Their family was going through housing insecurity. And she basically walks through the space like she runs the place. So we figured she'd probably be the best at giving a tour of respite centers. So we won't watch that video together just because the quality is poor while sharing screen, but on your own time, it's definitely worth it. It's just a minute long.
So the Respite Center philosophy, we believe parenting is one of the most difficult jobs. And we also believe, as I think everyone in this room believes, that while time breaks and a supportive ear can be really helpful to help parents return to parenting feeling more confident in their abilities. We think that the best way to ensure a bright future, not just for individual families, but for the community as a whole, is to come alongside families that are in need, to see them for their strengths and support those strengths. And that meeting a parent's needs is also meeting children's needs, and that we have to invest in families' mental health and well-being. And in particular, we need to destigmatize the need for a break and for that support. The Respite Center views itself as a preventative service. When you're thinking about parents who are experiencing a lot of sleep deprivation, a lot of stress on top of parenting, this can cause a very human reaction. Parents will react in a way that doesn't necessarily align with their values. So we like to see ourselves as a service that can kind of help families have the capacity to parent the way that they would like to, that matches their values.
So how we support families. We are a 24/7 around the clock service, meaning that if a parent is stressed out and they call us like at 3 in the morning on a weekend, there will be a person answering the phone. So that's when we can do crisis counseling over the phone, resource referral, and also maybe even meet their needs in that moment or schedule ahead. And we are open every day for we're open for daytime care, and we're also open for overnight care. There's one time during the week where we close, and that's Sundays between 9 and 5, and that was due to budgetary cuts. But other than that, we reopen that night, Sunday, for overnight. So we're available every night of the week for an overnight and most days of the week for the daytime care. The kids we serve are anywhere between being babies and being freshmen in high school. So we have a pretty large range of ways we can meet kids' needs. A lot of the times parents will use us first when they're in a time of crisis. Maybe they were referred to us by a hospital social worker or another service that they were using. And after they've used us in a time of crisis, the parent found us to be very useful to them. They realized their kids had a really good time, and then they call us in the future for breaks. That's usually how we see the course going. And we become kind of extended family for different families in the community that may otherwise not have people they can rely on to watch their kids when they need a break. So we get really close with families. The other thing is that there is no criteria. If you're a parent that's stressed out, we are here for you. And some parents can pay, and most parents we serve are low to no income and don't pay to use our service.
So here we have a list of the variety of reasons that we offer care to families in the community. I'm just going to highlight a few of them. One is homelessness. This is a really terrible problem in Dane County in particular. And we've frequently in the past, when we were serving more than one family before we had this virus that we're trying to contain, we would often add families to overnight shifts to be able to help families. Some families are sleeping in their car. Others are, the parents are able to stay with a family member or a friend, but bringing all the kids in might draw attention to being able to shelter the parent. And so the kids will come stay with us so that person isn't at risk of losing their housing. Since the pandemic started, we've been doing a lot of care for medical appointments. Regular non-COVID related medical appointments have not stopped just because of the virus, and since families can't bring their kids with them, we've been offering a lot of care for that. And so, yeah, while a lot of services shut down during the pandemic, we did stay open as safe as we possibly could and continued to serve families because the crises did not stop. So we have here a list or a total of 2,864 visits in 2019. That's much more representative of what we typically see in a year. It's been different with COVID because we've been not overlapping families, so we've been serving a lot less families in the last couple of years.
And upped our screening for sickness as well.
Absolutely.
So
now we're going to hear from some of our families. One is a quote that we received from a family who said, "I think that the last thing any mother wants to do is to fail her children and be left with no other option but to place her children into foster care. Your program prevented me from losing my children." And this quote really validates our purpose in the community. We strongly believe that no parent should have to lose their children because they don't have the childcare resources or resources to navigate a crisis. And that's where we come in. We help keep families together. And we're also going to, hopefully the video quality will be good. Let us know if it's not, but we have an interview with 2 parents who use respite, and they'll tell you about how the Respite Center has impacted their life.
all right, bear with me while I switch tabs so I can show you a video. This video hopefully has better quality than the other video. Okay. Can everyone see the full screen?
Yes.
Awesome.
My name is Dana, and I have 2 children. I live in Madison, Wisconsin, and I love the Respite Center. I had my baby in 2016, Abraham, and he is such a struggle inside the womb. But I had to stay in the hospital for a long time, like 4 days, and the Respite Center helped me with baby. I let my friends pick him up and drop him off at this was his house for a couple of days, and I appreciate them so much for that because I didn't have anybody at the time to step in and keep him all day while I was at the hospital, having his brother.
My name is Gillette, and my granddaughter is Ariana. I am a massage therapist. Her middle name is Rose, so I changed the name of my business to Rosebud because I tell her she's my budding little rose. Single parenting at 64 is different than having children when you're younger, because you don't have any grandparents and you don't have peers who have children, you know, that age. And so the Respite Center has been, no.
Another story was when I got my GED, high school education, was really I don't know how to explain it to you. I just appreciate this center so much. If it wasn't for you guys, I wouldn't be able to be so inspired to keep going just by having that little, push or help. I don't want to start tearing up here because I really, it's not a sad moment. It's a proud moment for me just to say that I did this and the Respite Center helped me, or just to keep their name alive and tell people, how they helped me.
My sister was like a mom to me. Was admitted to the hospital. Her son called in a Monday, and I called Respite Center in the afternoon and asked if you could possibly take Ari so that I could go to the hospital. But it was the last time that I got to talk to my sister, and it was not only that I got to have the last conversation with my sister, but it was where I was able to help her feel at ease with where she was, and so I'm, very grateful for that.
I just thank you for, using Respite Center because, if it wasn't people using this program, they probably would have shut it down years ago or whatever. Just thank you, and keep using the Respite Center and tell people about it.
I just want to say thank you for all the kind and loving support, and for just being there for us and for taking such great care of Ari. Everyone here is amazing. It's made such a huge difference for us to have Respite Center, and just such a difference for Ari to have this with her situation. Just to have such a safe, loving environment that she can go to, and such support for her is priceless, really.
I'm going to go back to the slideshow.
Right, so I'm sure you can see the kind of impact that the Respite Center has had on families in our community.
Yeah, and we know those two families particularly well too. And we just saw some of the boys from that one family recently, and it's really wonderful seeing those kiddos growing up and getting new unique personalities as they grow up. And it's been really special getting to know those families too. So next, I want to talk to you about why we're called childcare specialists specifically. So the reason we're called childcare specialists is because all of us are trained in trauma-informed care. Everybody who uses the Respite Center has higher education and has learned a lot about how trauma impacts children's brains and their behaviors, and it helps guide us every day in the work that we do. So this diagram here shows that no single kid responds in the same way when they're experiencing a high stress situation or trauma. You could even get two siblings who've had the same upbringing and same stressors, and they could respond to completely different coping mechanisms from one another. Just to give some examples, we see role reversing when we have a sibling, maybe an older sibling who takes care of younger siblings, even if the older sibling's still very much a kid themselves. And perhaps that sibling also takes care of their parent as well. We see regressing when there's a kid who's experiencing just a lot of change and they regress in their potty training. We'll see kids who have controlling behaviors when they really control the narrative of play. And a lot of times when kids feel like so much is happening around them that they don't have control over, that could be a common coping mechanism too. We'll see kids that act out, maybe everything gets really overwhelming to them, something triggers them, and they'll start throwing things and getting escalated. And we also see kids who withdraw and they just get really frozen, and that's like their response to stress as well. So I wanted to share a couple of stories just to highlight how Respite Center childcare specialists are able to meet kids where they're at. So with my first story, this happened a couple of years ago, so pre-pandemic. And I was on a shift where there was a 13-year-old girl being dropped off. And we knew going in through the intake process and having the caregiver get started with us that this child had experienced probably a 10-point ACEs score, had experienced like the most trauma I've ever seen a kid have to go through. And it's just awful that this is her backstory and what she's had to experience. And so going into it, I knew that this child had a lot of needs, and we wanted to really be there for her and offer a safe haven and gain her trust. And when she was being dropped off by her caregiver, which is her grandma, they were really escalated coming in. They were shouting at one another, and the grandma really needed a break. Tensions were really high between them, and eventually the 13-year-old agreed to stay, but she wasn't happy about it. And she did the withdrawing type of response where she just kind of secluded herself and didn't do anything, just sat at a table. And it wasn't interested in any of the activities we offered. So I knew based on conversations with the caregiver, our family advocates, and various people who are in her world that this is a common thing for this child, that she tends to try to test caregivers and adults and see if she's cold towards them, if they abandon her too. And so I knew that just sticking by her and showing her I'm not going anywhere, I'm here when you're ready, was the best thing I could do for her. And so I grabbed some coloring stuff and some piece of paper and just sat at the table, and we kind of sat in silence together. Occasionally I'd offer her something to do and she just kind of shrugged. And eventually the opening happened when her chair squeaked, and I said, "Don't you hate it when your chair squeaks and everyone thinks you farted?" And she starts laughing and I'm laughing, and it ends up kind of breaking the ice between us. And then she became open to suggestions for activities. And before you know it, we're doing art together, we're baking muffins, talking about the middle school girl drama and all of that stuff and having a good time. And then something shifts for her, and she tells me that she feels really guilty. And I ask her why she feels guilty. And she said that she feels guilty because now that she's having a lot of fun, she feels bad that she had yelled at her grandma. And I said to her, that is totally not your fault. That if I was her, if I was a 13-year-old coming into a space that looks like a daycare center, like I wouldn't know that I was going to have fun. Like, how could she have known? Like, I wouldn't have known until, being there. And so I told her it wasn't her fault. And if she'd like to, when her grandma comes, she can always share with her how she's feeling. And sure enough, like an hour later, when grandma showed up, the 13-year-old girl went running to her and gave her this really big hug. And I think that was the last thing grandma was expecting after how things left between them. But it just is this beautiful moment of showing how when tensions are really high, sometimes having that break can be so critical for both the caregiver and the child. The next story I wanted to share is about a 5-year-old boy. He was going through a lot of grief. One of his caregivers had passed, and he'd experienced some trauma as well in his young little life. And he's playing toys with his younger brother. And suddenly, I'm not really sure exactly what triggered him. Sometimes it's something as small as like wanting the same toy and having issues sharing that can suddenly escalate a kid into fight or flight mode. But he started getting really, really escalated, screaming, throwing things, threatening to hurt his little brother. And my coworker, she had this really, really tactful, very smart response. She first of all started by labeling his feelings and saying, like, you seem really upset and angry right now, and validating him, showing that she understands he's frustrated. And then she said, you know, sometimes when I'm frustrated, it helps if I go on a walk and take some space. Like, let's take some space from your little brother. And he was open to that idea. So they went on a walk throughout the building. They left the little childcare center, walked down some hallways, and ended up in a room where there's a fish tank. And while they're at the fish tank, she starts asking him, how many fish are there? And he's counting them. What colors do you see the fish? And he starts labeling their colors. And this was all very intentional, because when kids are growing up and having their early brain development in this really stressful environment where there's trauma, it tends to be that most of their like synapses firing, all of their brain development happens in their amygdala. It means so much of their early development involves that fight or flight response, that center of the brain that's about fight or flight and fear center. And so sometimes it can get triggered when a child is not in an unsafe situation, but their brain thinks they're in an unsafe situation. And by her starting to get him to think through logical questions and counting and labeling colors, this was intentional so that she could revert him back to his executive functioning, his reasoning and judgment center of his brain. And as they were walking back, she was like, do you remember which turn we took down this hallway? And once again, he's going through his spatial reasoning. Like, this was all so intentional by her part to get him to kind of ground himself and recenter and return to the space in a more calm manner. And so that was just a really good example of how staff use what they learn about trauma and how that affects kids and their brains and their behaviors to best meet kids where they're at.
All right, so now we're going to talk about our impact in the community from a numbers perspective. We're focusing on 2019 numbers just because 2020 and after has, of course, been very different. Our numbers have been much lower just for safety reasons. But in 2019, we served a total of 798 individual children at Respite, and there were nearly 3,000 times we had kids on the schedule. Typically, we see 12 to 20 kids in a 24-hour period, so those day shifts and overnight shifts. And the kids don't see it as appointments, of course. We have one child who frequently asks his mom if he can go to Lauren's house because he believes that Lauren lives there, because Lauren happens to be the person who's there the majority of the time he comes.
It's very cute. I can see how it could be confusing considering we're there overnight and in the mornings. And if you see the same person over and over again, you would think we live there.
And it's a very homey space too.
It is.
Right. So during the pandemic, when we weren't serving quite as many families as we typically do, we worked to find other ways of reaching out to families as well. We put together some care packages for families that had activities and books and snacks, just some stuff that could either help keep the kids busy while the parents can have a minute to breathe, or have something different for the family to do together, since everything got kind of monotonous, having to be safe at home. We also helped with provide some financial assistance for holiday gifts, for keeping food in the house, housing stability, some childcare costs. We received a grant to start a basic needs pantry at Respite, which has been really great because typically, if a family was out of diapers, or if a kid was saving their sandwich so that their mom could have half of it because there was no food in the home, we'd send families home with stuff. But this came out of our in-house budget. And so we decided to apply for a couple grants that could fund a basic needs pantry. So not only are we keeping our in-house stuff, but we're also able to provide more to families just because we have more available. Another cool thing that we got during the pandemic is we were able to receive a big donation of books, where we were able to kind of select books that had characters that were more representative of the kids that we served, and some of the books that talk about different topics related to trauma or related to the pandemic and mask wearing and all that kind of stuff, to kind of help books are a really great way for kids to process things that they've been through. So it was really cool to be able to get to revamp our library. We are also a nationally recognized program. A few years ago, we received the Innovative and Exemplary Respite Services Award by the Arch National Respite Network. And while we are honored to receive such a prestigious award, the best feedback that we get comes from the kids, who have a lot of really positive things to say about respite. I have a few here that I'm going to read. One kid says, "I like it as long as I get to ride the scooter." Another child says, "I want to live here. Can I live here? I love it here." And one of my personal favorites refers to a former childcare specialist who's now our facilities manager named Chris. And this child, when asked what they love about respite, said that he loves Chris and toast.
We make really good cinnamon sugar toast. We're kind of known for it around the town, you know. So now that you've gotten some context for the Respite Center, I wanted to talk to you about our first quantitative study. So when we had won that award that Erin just spoke about, they wanted to see quantitative evidence for our program's like evaluation. And we had tons of anecdotal evidence, lots of stories of parents sharing the impact respite's had on their lives, just like the stories you witnessed in that video. But we didn't have any quantitative data. So we had some extra time on our hands during the pandemic. So we started the parent wellbeing study. And as you can see, it was a survey, pre and post survey model. And once they filled out the survey, they'd put it into that little box slot and they'd get to take a book with them that was a gift for participating in our study. And we actually got those books donated from the Love of Learning grant through Phi Kappa Phi so that we could offer a gift as like a thank you for participating in the study. The survey study went from September 2020 to September 2021, so it was a full year long. And the main purpose of the study was to see if the Respite Center was able to reduce parent stress. And so the very first question on the pre and post survey was for parents to rate their stress levels at 1 through 10. And we'd ask them again when they would pick up their kids. So it was like right before you get your break and after you received your break, and to see if their stress level changed. On the post survey, we also asked some other questions as well, because usually they had more time to answer some other questions that didn't need to be asked twice when they were picking up their kids rather than beforehand when they maybe were rushing somewhere else. So we'll get into those specifics on a couple slides later. So I wanted to talk to you about why parents were using our service. This is one of the things we put on our survey just to keep track of the reasons parents used our service. And so these were the reasons parents used our service during that year-long duration. So the main reason was for relief breaks. So what that could be is a new parent, they are sleep deprived, exhausted, and desperate for a break. And they call us and they're like, "Can you take my kids for a few hours?" Or, "I just need to catch up on have a good night's sleep. Can you take them overnight?" So that was the relief breaks. Another big thing we did for families was medical wellness appointments. So parents needing to go to doctor checkups. And for some parents, that was a regular occurrence if they had a chronic health condition. They were no longer allowed to bring their kids with them to these appointments due to COVID restrictions. So we filled a very large need during the pandemic for that. Mental health emergencies was another thing that we saw a lot of during this study, because when you're isolated during the pandemic, it really exacerbated people's well-being, their mental health issues. It was just something that a lot of parents were calling and really needing a break for. And as you can see, there were a lot of other reasons parents used our care. Those were just the largest reasons. So our main question was, does a respite break reduce parent stress? And overwhelmingly, the answer was yes. So what was really great was that we saw that the mean stress levels of participants was significantly less after using the Respite Center. And that's huge because in order to find that significant difference between means, the result had to have a p-value that was less than 0.05. And the one we found was less than 0.001. So that's like super significant, very strong results. And this shows that Respite Center, we can say, was effective at reducing parent stress, which is like what we're all about. So that was wonderful to find. We also analyzed the stress levels, stratified that by reason for care, as we went over in that pie chart. We wanted to see for each reason the parents used us, whether it was a break or medical appointment, housing insecurity, job search, whatever reason they used our care. We also found significant results for each of those reasons we broke down. We also did the same t-test for parents based on their demographic, their self-identified identities. whether it was a daytime visit or an overnight visit, whether the children that they brought to us had special needs or not. And across every single category we did the test for, we found significant stress reduction. So we had, like I said earlier, there were other questions on the survey. And one of the questions that we had people respond to was, without services from this program, I am able to find safe, reliable childcare when I need it. And we wanted to see if that was the case for parents all the time, never, somewhere in between. And we found that on average, parents said they could very seldom to occasionally find that safe, reliable childcare when they need it, meaning if respite did not exist, they would be having a hard time finding that care when they need it. The other question we posed, or the statement we posed, was, respite center is a good break for my child. And on average, parents strongly agreed with that statement. Respite center helps me reach my goals. So some, like the first parent in that video we showed, she was taking courses and getting her education on track and towards a career. And so a lot of parents will use us so that they can do personal goals. And so when responding to this statement, on average, parents strongly agreed that respite helps them reach their goals. And lastly, we were very curious about whether COVID-19 was going to be a confound to our study. I mean, we're evaluating people's stress levels, and COVID was very stressful to our staff team. And what we found that was interesting was that parents on average disagreed or were neutral as to whether COVID-19 was a primary stressor. What we found through conversations with parents is that parents' stressors were existing pre-pandemic, and they existed during the pandemic, and they're just long-term stressors, and those were the primary stressor for them. And COVID only exacerbated the economic hardships that were associated with those stressors, and various like barriers that were put in place when they needed to seek out resources. And so we found that COVID-19 was not parents' primary stressor on average. It was usually what was going on with them outside of the pandemic. So that we were able to kind of rule out as a confound to their self-rated stress levels. So now that we have gone over these results, we've gone over the context to the Respite Center, we're curious if you have any questions for us. It looks like we have some stuff in the chat here. I'm bringing up the video in case anyone wants to pop in the video, or you can go in the chat too. All right, I'm seeing some messages. Oh, we have a question. Okay, is the population you serve only children/adolescents? So the population we serve, like the kids that we offer care for, are between 0, so newborn babies, to 14 years old, so like freshmen in high school. And once they turn 15, they're aging out of our program. But technically our service is there for caregivers in a sense, because we're watching the kids so that caregivers can have a break. I hope that answers that question. And if anyone has any, another question. How are you primarily funded? By grants? If someone wanted to learn more about how you operate, could we reach out to you for more information? Lovely. Do you want to answer the funding?
Yeah, so we primarily get funding from the Dane County and the city of Madison. Those are our two big funders. And the rest of it is funded through grants and private donations. Yeah, absolutely. Please feel free to reach out to us. We've got our email addresses here, and they'll get sent out with the presentation in the email as well.
Yep, and if you'd like, you could also like pull your phone out, take a picture of this slide if you want to keep track of our email address. Otherwise, RCAW will send out a follow-up email. Mm-hmm. And I see the next question is, do you only service Madison? So the answer is no, we serve outside of Madison too. We'll have parents who drive. We had a parent who was going through ongoing cancer treatments, and she was driving about 2 hours to drop her child off and then go to UW Hospital, which was where her appointments were. And so we'll see parents that are driving from far away. There's just not a lot of respite centers around that do what we do. So we are the hub for that. So yeah, some parents drive from far away. Is our facility licensed?
Yeah, so we have both a child care center license as well as a group home license. And to my understanding, the way that works is typically the child care licenses, those rules are like kind of focused on the daytime, and then the overnight is that group home license. So that part gets a little complicated, but yeah, we have those two licenses.
Thank you for all these questions.
Yeah, these are great questions.
All right. So in case more questions pop up, otherwise you're also welcome to unmute yourself and ask a question too. That's fine as well. Otherwise, looks like we're good on questions. So we'll leave you on a cute note.
All right, thank you so much for your time. We just wanted to end with a few cute kids quotes, because who doesn't love a good cute kids quote? So one kid says, "I love this place so bad. This is the coolest place. I wish I could come here every day." Another child believes that respite is a magical kingdom. And then this one is my favorite. One child said, "I know why this is called the Respite Center, because moms can go drop their kids off and rest a bit."
I love that logic. All right, we're going to stop sharing our screen, but you're welcome to ask us any more questions that arise.
Lauren and Erin, thank you so incredibly much. I was getting goosebumps and a little choked up listening to your stories, and thank you so much. I hope you give yourself the credit that you deserve in making the community a better place.
Thank you. I appreciate that.
Absolutely. I did just send an email to everyone, including Lauren and Erin's emails, their presentation from today, my presentation from today, their bios, and as well as the video that of the meet our CEO, the kindergartner giving a tour of your center. And this recorded presentation will be on our YouTube channel by the end of the day tomorrow.
Wonderful. Thank you.
Thank you so incredibly much once again, Lauren and Erin, and thank you everyone for coming. Have a great day.
Thank you, everybody.
Thanks.
Thank you.